Best EHR Software of 2026. Welcome to part 2 of our 10-part series on the best healthcare software of 2026. In this episode, it's all about EHR, electronic health records, the clinical system of record at the heart of every healthcare org. We'll cover what makes a great EHR, as well as some of the best platforms for small practices, mid-market organizations, and enterprise health systems. Before we dive in, this video is sponsored by several healthcare software leaders, including our title sponsor, athenahealth, as well as our other sponsors and partners, Elation Health, NextGen, drchrono, CareCloud, and TotalMD. What a stellar group of platforms. You can learn more about each of them through the links in the description. All right, let's dive in. What is EHR software? An EHR, or electronic health record system, is the digital record of patient care. It captures clinical documentation, medication lists, problem lists, lab results, imaging, care plans, and the full clinical history of a patient across encounters. It's the system that clinicians work in every day, which means EHR selection has direct implications for provider workflow, documentation burden, and ultimately patient care quality. In 2026, the EHR market is consolidating around a handful of dominant platforms at the enterprise level, while the small to mid-market space remains more fragmented and specialty specific. Clinician burnout driven by EHR documentation burden is a documented, measurable problem, and in 2026, how well a platform reduces that burden is as important as its clinical feature set. Best EHR software for small practices. For small practices, EHR selection is often the most consequential software decision they'll make. The wrong choice creates documentation burden that drives clinical dissatisfaction, billing errors that leak revenue, and workflow friction that affects every patient interaction. The best small practice EHR platforms minimize documentation time, specialty-specific templates, smart text, and AI-assisted note generation that let clinicians document quickly without sacrificing completeness. Integrate clinical and billing, EHR, and practice management in one system, so charge capture happens at the point of documentation, not as a separate step. Support e-prescribing and labs. Direct electronic prescribing to pharmacies and bidirectional lab ordering and results. Core workflow requirements for virtually every outpatient practice. Stay affordable and fast to implement. Small practices need to be seeing patients quickly, not after a 6-month implementation. Cloud-based, quick start platforms with specialty-specific configurations out of the box. Prioritize regulatory compliance. Includes meaningful use, promoting interoperability compliance, MIPS reporting support, HIPAA-compliant data handling, and more. Here are several EHR platforms consistently chosen by smaller practices. Note, these are listed alphabetically. You can see the platforms on the left, with notable callouts on the right. I won't read through every single one because we have a lot more to cover, but I recommend taking a screenshot and returning to this list later, then setting up demos to see them in action. There are also links in the description to detailed feature breakdowns in the Select Hub platform. There you go, some of the best EHR options for smaller practices. Before we move on, a quick shout out to our title sponsor, athenahealth. Unlike systems that bolt together separate modules, athenahealth, whose Athena One solution provides EHR, practice management, and revenue cycle management, serves medical practices and health systems in one unified system. Their single instance network of over 170,000 clinicians and 117 million patients gives them a scale that's hard to match in ambulatory care. Plus, Athena One is AI native from the ground up. The platform brings AI into the workflows that power ambulatory care, helping practices deliver care, manage revenue, engage patients, and run more consistent day-to-day operations through one connected platform. Thanks to athenahealth for supporting this series. Check them out through the link in the description to see if Athena One is the right fit for your organization. Now, back to the show. Best EHR software for mid-market organizations. Mid-market healthcare organizations, including multi-specialty group practices, regional health networks, community health centers, and more, need EHR platforms that handle clinical complexity across multiple providers and locations while remaining usable by clinicians. Mid-market EHR buyers typically look for multi-specialty and multi-provider support, the ability to configure different workflows, templates, and order sets for different specialties within a single system, population health tools, patient registries, care gap identification, chronic disease management dashboards, and proactive outreach capabilities for value-based care performance. Interoperability, FHIR-based data exchange with hospitals, labs, pharmacies, payers, and other EHRs, because patients don't stay within your network and their records shouldn't be siloed. Revenue cycle integration, tight connection between clinical documentation and billing, with charge capture, coding assistance, and denial management built into the clinical workflow. Analytics and quality reporting, HEDIS, MIPS, and value-based contract performance reporting that doesn't require a data team to produce. Here are several platforms often chosen by mid-market healthcare organizations. Again, screenshot this list, and there are also links in the description where you can get a much more detailed breakdown feature by feature in the SelectHub platform, as well as compare analyst scores. Our analysts have reviewed popular EHR platforms in depth and ranked them with scores based on a myriad of factors. So, if you're in the market, you definitely don't want to miss these comparisons. Links to the SelectHub platform in the description. Best EHR software for enterprise health systems. At the enterprise level, your EHR is enterprise infrastructure on the scale of a financial system or an ERP. The implementation may cost tens of millions of dollars, and the impact on quality care, efficiency, and regulatory compliance touches every corner of the organization. Enterprise EHR platforms need to support unified patient record across the enterprise, a single longitudinal patient record that follows the patient across all sites of care, ambulatory, inpatient, ED, surgical, without data reconciliation gaps, inpatient and outpatient on one platform. The convergence of inpatient and ambulatory EHRs on a single platform is a major trend at the enterprise level, driven by the operational and clinical benefits of a unified record. Advanced clinical decision support, drug-on-drug interaction alerts, evidence-based order sets, sepsis detection algorithms, and AI-driven diagnostic support embedded in clinical workflows. Research and analytics infrastructure, data warehousing, de-identified research datasets, population analytics, and operational reporting that supports both clinical quality improvement and academic research. Regulatory and accreditation compliance, Joint Commission, CMS conditions of participation, promoting interoperability, and state-specific reporting requirements all managed within the EHR. Here are several platforms consistently chosen by large health systems. Screenshot this list and dive into the links for SelectHub's feature-by-feature comparisons. Links to the SelectHub platform are in the description. There you have it, an overview of some of the best EHR software in 2026, from small practices through to enterprise systems. For more EHR resources, including pricing guides and SelectHub's database of feature comparisons, check out the links in the description. One more big thank you to the sponsors who made this series possible, including our title sponsor, athenahealth, as well as our other sponsors and partners, Elation Health, NextGen, drchrono, CareCloud, and TotalMD. Each of these brings unique value depending on your organization's size, specialty, and clinical needs. Links are in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time. Cheers!